Hi, it's Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. Today's tip is about PEG tubes versus nasogastric tubes. Currently we're working with a client who had their dad in ICU. Their dad has just come out of ICU a couple of weeks ago. They've been weaned off the ventilator after a brain injury, but they still have a tracheostomy and a nasogastric tube in. Now the client's dad is not ready to have the tracheostomy removed quite yet, and they've been having a nasogastric tube for feeding. But my client's dad keeps pulling out the nasogastric tube, and now the neurology team there is suggesting to insert a PEG tube. So my thoughts on that are, PEG tubes have their time and their place if your loved one keeps pulling out the nasogastric tube. But especially when somebody is close to having the ventilator and tracheostomy removed, my suggestion is to keep going with the nasogastric tube, because a PEG tube just simply is a small operation or a small procedure, and you should avoid a procedure if it can be avoided. So nasogastric tubes are better, especially since it keeps pushing things along and it's short term, whereas PEG tubes are long term, and it can make people complacent to remove the tracheostomy, because that's the goal. The goal is to have the tracheostomy removed, have the nasogastric tube removed, and also have a PEG tube removed if you are deciding to consent to a PEG tube. That's my tip for today, and I'll talk to you in a few days. This is Patrick Hutzel from intensivecarehotline.com.